I will be happy to introduce our speaker today, who I've known for a while. We've done work through the Drug Free Communities Grant. Joanna Lowry. She currently serves as Director of Addiction Services for the Butler County, Ohio Mental Health and Addiction Recovery Services Board. She's a licensed professional clinical counselor, supervising counselor, and a licensed independent chemical dependency counselor, clinical supervisor in the state of Ohio, and has worked in the field for about 10 years. Joanna receives a master's in mental health counseling from Cincinnati Christian University and has experience in public and nonprofit mental health and addiction organizations. She has worked with lots of people, lots of ages, lots of backgrounds. She's fun to work with. She's an expert in her field, and we all need a little mental health first aid these days. So I will turn it over to you, Joanna. You're on mute, though.
Hi. Let me get my screen shared up here so I can share my PowerPoint. Let's see. Okay, can everybody see that? Okay. So again, my name is Joanna Lowry. I'm the Director of Addiction Services at the Butler County Mental Health and Addiction Recovery Services Board. And Christy asked me to share a little bit about mental health in the workplace. So first, I just wanted to talk about the community and the nation, just to kind of pose some questions for you to think about as we go through the day. First, kind of thinking about what have you heard or seen in the news lately? How have you been impacted? How has your business been impacted? Your employees and your customers? Kind of think a little bit back on 2020. It wasn't that long ago, but I know we're all working to move forward. But think about how things have changed. How have you and those around you changed? And as you think about the future, what do you anticipate and how do you feel about what you see? Again, these are all questions to keep in mind as we go through today's training, and especially how your employees may be impacted. So first, just the definition of what is mental illness. So when we talk about mental illness, there's a manual that we use called the DSM-5. And it has criteria on how we diagnose mental illness. So they look at 5 factors for mental illness: a behavioral or psychological syndrome or pattern that occurs in an individual. A mental illness reflects an underlying psychobiological dysfunction. So something that's can be affecting your body as well as your mental state. The consequences of which are clinically significant distress or disability. So we really look to, when we diagnose someone, is this impairing their lifestyle? Is this impairing their ability to function day to day? Also, it must not merely be an expected response to common stressors and losses, or a culturally sanctioned response to a particular event. So if you lose someone close to you, if they pass away, or if there are events that have occurred over the last year that have been saddening, and it's to be expected. So those normal responses or cultural responses, we look at those are not considered a mental disorder. However, they can move into that sphere if your grief begins to affect your ability to function in life long term. And their primary result of social deviance or conflicts with society. Stress, anxiety, depression, substance abuse are common symptoms experienced by people with a mental health condition. As we think about those questions I posed at the beginning, anxiety is a real feeling that many people are experiencing right now. a feeling of apprehension or fear. And the source of this uneasiness is not always known or recognized, which can add to the distress you feel. So if we think back to all the uncertainty right now, in several different arenas, health, politics, relations between people, and not always knowing what the future holds. Anxiety disorders are a group of psychiatric conditions that involve excessive anxiety. So again, you witness something on TV, you may have felt anxious, but does that anxiety continue day after day for several hours a day to where you don't want to leave your home, you don't want to leave your bedroom, and you aren't able to go out and accomplish your everyday tasks? Anxiety disorders are among the most common mental health conditions experienced by Americans. So we often look at generalized anxiety disorder. There are several different anxiety disorders, but this is the most common. So the presence of excessive anxiety and worry about a variety of topics, events, or activities. Worry occurs more often than not for at least 6 months and is clearly excessive. The worry is experienced as very challenging to control. The worry in both adults and children may easily shift from one topic to another. So people express this as their mind is racing. They have difficulty following through with a task because they just keep thinking of what's going to happen from one experience to the next. The anxiety and worry are accompanied by at least 3 of the following physical or cognitive symptoms. In children, only one of these symptoms is necessary for diagnosis of general anxiety disorder. So often people are edgy or restless. They tire easily, fatigued more than usual, impaired concentration or feeling as though the mind goes blank, irritability, which may or may not be observable to others, increased muscle aches or soreness, difficulty sleeping due to trouble falling asleep or staying asleep, being restless at night, or unsatisfying sleep. So one thing I wanted to just keep pointing out during this presentation is there are certain criteria that we use to diagnose somebody, but also you may notice signs of anxiety in yourself or those that you supervise or work with day to day, especially during these challenging times. You may find yourself tiring more easily, being more fatigued, edgy or restless, irritable, especially in a work environment as we work closely with each other, but we're also dealing with our own outside personal things. You may notice that someone snaps at you more often or that you feel more easily annoyed by your coworkers. There we go. So there are common types of anxiety disorders. And so you may have heard of some of these: panic disorder, obsessive compulsive disorder, post-traumatic stress disorder or PTSD, phobias such as social anxiety, and generalized anxiety disorder, which we went through. It's important when you think of these that while you may have some of the symptoms, that you may not qualify for a clinical diagnosis. And it's also important to be respectful of people that may have these, such as obsessive compulsive disorder or PTSD, and not to simplify these by using them in everyday language, saying, I'm just OCD, or that situation gave me PTSD. To really think of the weight that these carry and to be respectful of people that are dealing with these and managing these symptoms every day, but also recognizing that there may be symptoms that you have as well, and we'll talk about some ways to manage those. Depression is another common mental health condition. When we diagnose depression, we look at, are people having a depressed mood most of the day, nearly every day? Is there markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day? So not only are you feeling down, but you really don't have an interest in doing anything that you used to enjoy. Sometimes there's significant weight loss when not dieting, or weight gain, or a decrease in appetite nearly every day. A slowing down of thought and a reduction of physical movement, which is observable by others. So it's not merely a subjective feeling, but people notice that you speak more slowly, that you move more slowly through when completing tasks. And along with this comes fatigue or loss of energy nearly every day. There's feelings of worthlessness or excessive or inappropriate guilt nearly every day. And in a work environment, this may come out as people not feeling confident about the work that they're doing when you notice before they complete a task with ease. They may start putting themselves down. We talk about diminished ability to think or concentrate or indecisiveness nearly every day. So you may notice that someone's work starts slipping where they can't keep up with the workload that they used to manage before. And recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. Common types of depressive disorders are major depression, persistent depressive disorder, where somebody has a low-grade depression every day, nearly every day of their life, bipolar disorder, and seasonal affective disorder. So a lot of times we find that especially during the winter and especially now during COVID, where people can't get out a lot, it's dark, people start feeling more depression and depressive symptoms than they do in the middle of the summer where there's lots of light, warm temperatures, the ability to get out and interact with other people. And again, just to point out bipolar disorder, there are certain criteria that we look at to diagnose someone as bipolar. And again, this is a diagnosis that holds some weight. So not to joke around and especially in the workplace saying, well, I just think he's bipolar or I think she's bipolar, that we look at what someone may be experiencing and make the appropriate referrals. I also wanted to talk about today adverse childhood experiences. So we talked about depression, anxiety, symptoms you may experience or others may experience, how you may see those in your workplace. But it's also important, and something that's really big in the field right now is looking at these adverse childhood experiences. So in the mid-90s, a doctor at a weight loss clinic noticed that many of his patients were very successful at the beginning with the surgery. So they would lose weight, get to their target, and then something happened and they would gain all the weight back. And so he wanted to help his patients be successful. So he started interviewing them and just looking at kind of asking them what happened in their life, in their childhood. And what he found was that the people that were the least successful had these adverse childhood experiences in their life. So as you can see in the chart on the right, these included things like physical abuse, emotional abuse, sexual abuse, physical and emotional neglect, mental illness in their family or their parents, a parent who was incarcerated or a relative that was incarcerated. They witnessed violence in their home, especially towards their mother. They had substance abuse in their home, or in their home there was divorce. So we started looking into making this an official study. Around the same time, there was a lady, Nadine Burke Harris in California, that also was seeing that in her clinic, in a lower economic section of town that many people were coming to her, and their families thought they had ADHD. And what she found was that they didn't meet the criteria for ADHD. And when she looked at the study, she realized that many of the people and many of the kids had trauma in their homes and had this abuse, neglect, and household dysfunction. And why this is particularly important, especially as we talk about mental health in the workplace, is that these are experiences we bring with us into adult life. We bring reactions with us to how we learned in our childhood to react to things. So in this study, 17,500 adults were surveyed, and results were correlated with their health outcomes. And what they found is 60% of people had at least one ACE, or adverse childhood experience. People who had 4 or more ACEs were 2 times more likely to have lung cancer, 4 times more likely to have depression, and 12 times more likely to have suicidality in their life. People with 7 or more ACEs were 3 times more likely to have lung cancer, 3.5 more times to have heart disease. And this has to do with, in part, living in these trauma and stressful situations. If you think about maybe you get in a car accident and you have this adrenaline pumping through your body and your heart rate speeds up. Imagine living in that state for much of your childhood and possibly into your adult life. Those chemicals that that being on edge really wears on your body, and not only affects you mentally, but physically. So just as a exercise, I wanted to pull up the ACE, and I'll read the questions, the ACE questionnaire, and just read through them. If you want to, you can kind of keep a tally of these questions just to see where you would fall. So let me see if I can pull that up. Okay. So here are the questions. Did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you? Or act in a way that made you feel afraid that you might be physically hurt? If yes, enter 1. Did a parent or other adult in the household often push, grab, slap, or throw something at you? Or ever hit you so hard that you had marks or were injured? If yes, enter 1. Did an adult or person at least 5 years or older than you ever touch or fondle you or have you touch their body in a sexual way, try to or act have oral, anal, or vaginal sex with you? If yes, enter 1. Did you often feel like no one in your household loved you or thought you were important or special? Your family didn't look out for each other, feel close to each other, or support each other? If yes, enter 1. Did you often feel like you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if needed? If yes, enter 1. Were your parents ever separated or divorced? If yes, enter 1. Was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Or sometimes or often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over a few minutes or threatened with a gun or knife? If yes, enter 1. Did you live with anybody who was a problem drinker or alcoholic who used street drugs? If yes, enter 1. Was a household member depressed or mentally ill, or did a household member attempt suicide? If yes, enter 1. And finally, did a household member go to prison? If yes, enter 1. So the reason I ask these questions is not, oops. Okay, let's see if I can share the PowerPoint again. So the reason I asked those questions was not to shame anybody or make anybody's life difficult, but was to make people aware of the fact that many people, again, have at least one ACE, and we're all dealing with experiences throughout our life. Now, we did talk about how these can lead to health problems, but it doesn't have to. So there is hope, there is help. With proper interventions and with treatment as adults, people can lead healthy, what we would call normal lives and be productive. Again, we talked about some of the behaviors that come with adverse childhood experiences. So lack of physical activity, smoking, alcoholism, drug use, missed work. Physical and mental may include severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, and broken bones. So it's important to recognize that things may have occurred in childhood into adulthood and to seek the proper outlets to get help with that. Again, this slide is what we've talked about some, thinking about childhood as a time for learning. So often we have languages, music, motor skills that we learn during childhood, and a number of connections in our brain dramatically increase after birth. So in this chart, it just shows that many of the activities on the left side of the chart occurred before 7 years old. Excuse me, I'm gonna get a drink. So if we think through what kind of messaging people got before the age of 7, how to view authority figures, how to view the police, how to view work, how to view just how to interact and talk with others. So people bring this with them into their adult lives, into the workplace. And so there's a lot behind someone's behavior, and it may not be just that they're trying to be difficult. So one helpful example just to think about in non-technical ways, but to learn about the brain, is called the hand brain. So if you take your hand and you think that you're looking at it as a view like this, as if it were on my head. So if we take our hand and we think that this part, our wrist and our arm, is our spinal column, and this is the middle of our brain, our brainstem, and we put our thumb here, this is called the amygdala. And this controls our big emotions like fear, anger, anxiety, whether we fight, flight, or freeze. Then if we fold our fingers down, this is our prefrontal cortex, or the part of our brain that does reasoning. And often trauma affects someone's ability to reason and to make decisions. If you're in a trauma situation, your thoughts bypass or don't go to this prefrontal cortex. They stay in this part of the brain where you have to flight, fight, or freeze. Or they may have gotten some help. There may have been that person in their life that walked them through situations in life. So maybe sometimes they're operating kind of like this, where there is some decision making, but it's also kind of overlapping this part of their brain that's telling them to fight, fight, or freeze. With therapy, with interventions, we can get to here. But this may be why you see certain people in your workplace, excuse me, that always seem to have outbursts. You may have difficulty having a conversation. So just to be aware that there are things behind that behavior often. I also wanted to talk about just a little bit about co-occurring disorders. Sorry. So it is very common if we think out of the 57.8 million adults who either have SUD or substance use disorder and a mental illness, 9.2% million of those adults will have a co-occurring mental health and substance abuse disorder. So it's very important to keep that in mind. Clients using substances may have co-occurring disorders that can be triggered by or exacerbated by their use. These disorders can include depression, anxiety, post-traumatic stress disorder, psychosis, or schizophrenia. One doctor, Dr. Gabor Mate, proposes that all substance abuse are painkillers. So physical pain and emotional pain are the same. People are using substances to get rid of that pain. Pain comes from emotional pain or trauma, and only when compassion is present will people allow themselves to see the truth. To experience pain without running away from it. So while in a workplace, you may not be the professional to help someone through their depression, anxiety, substance use, you can be that compassionate member that gives them the resources. Again, co-occurring disorders, all the contortions, this quote is, all the contortions we go through are just not to be ourselves. Sometimes people have difficulty living with that anxiety, depression, and so substances are a way to not be in that state. Treatment for both mental health and substance abuse disorders often is the best combination is thought to be medication and therapy. There's also exercise, socialization, and stress management techniques. They're good supportive activities and treatments. Other treatments may include acupuncture, aromatherapy, breathing exercises, exercise, meditation, nutrition and diet therapy, and vitamins. I also wanted to talk about stages of change. So after you give somebody resources for their mental health or substance use disorder, there are stages of change that we look at as clinicians. So this goes from pre-contemplation. People typically don't think they have a problem. Contemplation, they're thinking about changing, maybe cutting down, maybe thinking about going to see a therapist. In preparation, the person is moving towards planning and preparing for carrying out changes they have contemplated. Then in action, a person is going through this change. Finally, in the maintenance stage, a person focuses on contributing to achieve and maintain their progress made. While on this slide, we go through this stages of change very linearly, it's, I'm sorry. It's important to recognize that people don't go through these changes like that. So sometimes people may be in preparation and action stage and something difficult like a pandemic hits and they're back to contemplation. So it's important to recognize that people may not change fully right away, that it takes time. We talked about that. So what can we do? One is to be aware of our thoughts and feelings. What are your thoughts about mental illness? And what biases may you hold based on your lived experiences, family members, society? What are you thinking and feeling during this time? What areas would you like to research more and learn more about? And how can you be an advocate for change or create a productive yet supportive work environment? So how can you be that advocate in your workplace? And I wanted to show a short video clip. See if I can pull it up.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So why I like that video so much is it really encourages connection. Sometimes there is no right thing that we can say in a situation, but we can say, I know that must be difficult. Here are some resources that we have that you can take a look at. Empathy drives connection, like she said, and sympathy drives disconnection. So it's important in these situations to kind of connect with that part of us that also may have felt a similar pain, or that knows what it's like to feel pain or difficulty or feel stuck. Empathy is perspective taking, staying out of judgment, recognizing emotions in others, and communicating those emotions. Sounds like you're having a really tough time right now. What I really liked that she said during that video is that empathy is feeling with other people. It's a choice that we make to be vulnerable, to connect, to draw deep within ourselves, to find a time when we have felt the same. Again, connection, helping people find their spark, or helping them find that one thing that they really connect with. And that may be at your workplace, and that may actually be helping them find the place that's best for them. Relationships promote resilience. And this may not be sharing every deep aspect of your life with someone at work, but being willing to stop by someone's desk and promote interaction and relationship in that way. Changing relationships can change attitudes and behaviors. And there can be different levels, like we talked about with relationships. So making a connection, getting to know the person, and identifying and encouraging a person's strengths, talents, and passions. Also recognizing behaviors in employees and coworkers and in yourself. So a saying is, call a duck when it's still an egg, or call a crisis early. So we're not waiting until we've noticed someone's work is slipping. We're not waiting till it kind of implodes, the situation implodes before intervening. We're saying we have a resource available, but really addressing them when it occurs. But sometimes we don't intervene early enough, and it's not out of malice. Sometimes it's that we're really busy. We have our own things going on in life. There's deadlines, there's COVID. So just being aware and recognizing people's behaviors and being intentional about that. Recognizing our reactions to situations. In a crisis situation, emotion goes up and typically reasoning goes down with people and with ourselves. So just being aware that sometimes if a person has missed work a lot, deadlines aren't getting met, and there's pressure on you, that often your emotions will be heightened and so will the other person's. So knowing that we may be in that a more emotional state, to avoid a power struggle in that situation, to find a time when you can address those behaviors in a non-judgmental but appropriate, non-emotional way. So know your physiological reactions. When you start getting very upset, does your heart race? Does your body get hot? Do your palms start to sweat? Because those are cues that you may need to walk away for a moment. Know your weaknesses, your buttons, your hooks, what words that people say that really may irk you and get under your skin. Know your strengths and know your team member strengths and weaknesses. You don't have to do it alone, and you have people who are also supportive. And again, this is taken from trainings I do, clinical trainings. But again, if you're not ready to talk to somebody about their behavior, but waiting isn't an option, commit to having a future plan to share with that person. Say, you know, this isn't the best time for me to talk. We do need to talk about what's going on though, so let's talk on Monday. Because that'll give you time to calm down, process your thoughts, maybe pull someone else into the conversation when you're not quite as emotional. And recognizing compassion fatigue, not only during COVID, that being preoccupied or overseeing others can result in your own tension and stress. Gradual lessening of compassion over time to the level of exposure to traumatic events yourself. And maybe you don't consider them traumatic, but events where you're having to be aware of other people's behaviors for long term, where you're dealing with one issue after the other, that's wearing. This can include chronic exhaustion, depersonalization, irritability, difficulty sleeping, headaches, weight loss, weight gain, feelings of inequity, loss of empathy, or indifference to those around you. So practice self-care yourself as well. Be kind, but set boundaries. Take time for yourself, make yourself a priority, and reach out for support. And here are some resources just in the Butler County area. It's the number to our Butler County Mental Health and Addiction Recovery Services Board, the number to NAMI Butler County, or the National Alliance on Mental Illness. They have wonderful mental health resources, support groups for people, support groups for family members of people struggling with mental illness. They just have a wealth of information. We also in Butler County have a Butler County Crisis and Resource Line. And this is available whether you feel like you're in crisis or you just need some resources for mental health or substance abuse. Also, when calling this line, people can get connected to Mobile Response and Stabilization Services, or MRSS. So what this is a program for families and their children up to age 21, the child up to age 21, in which the family defines the crisis. Workers will come out, talk to the family, and get them connected to resources in the community, and they will stay with them for at least 3 months. So maybe someone in your workplace isn't personally experiencing these issues, but they have a family member who is. You can call this line to get lots of information. And again, EAP services. And a lot of these are available for workplace employees that may not actually be on the insurance. So that may be worth looking into as well. It's important also, in summary, just to not lose the unique story of the person you're serving in a series of forms, check marks, and boxes. So we have HR paperwork we have to fill out. We have resources to give someone, certain things that are important and legally important, but not to lose that that's a person in front of you with a unique story and background. And here's my contact information. And I gave these slides to Christy so she can share them out as well. Thank you.
Thank you, Joanna. If anybody has any questions, please type in the chat and Ben will be fielding those. But I wanted to comment when you're talking about the brain and the frontal cortex, just that's in our drug-free communities grant, we do prevention in youth, and that's one of the things, that frontal cortex is developing until your mid-20s, and that's why it's important we try and keep our youth from using substances, which chronic use before that age can rewire the brain to make them more susceptible to other addictions. And I think probably trauma affects the same way as that substance abuse would at an early age, is what we learned today. But yeah, I love that little video. Brene Brown is, if you like TED Talks, she's a good TED talker. I like to watch her stuff. I don't see any questions popping up, Ben. Do you see any? You disappeared on us again.
No, I don't see anything. I'm still here.
Still there.
Yeah,
disappeared
I
on
typed
us.
it in and I don't see anything out there. So
you did such a good job, Joanne.
Yeah.
But it is, hopefully you got some resources today. It's just a reminder of, that connection. I'm reading, well, I haven't got too far, but I will have copies. I was going to give one because I ordered two. Let's see. The people in the workplace, the human touch and workplace safety. It's kind of like that performance-based safety, which I'd love to get a good speaker about that. It's that connection, that relationship, it's, and that's what we've missed with COVID, the connections.
It really is.
Yeah. You can only do so much on Zoom. I mean, thank God for Zoom. Can you imagine if there wasn't Zoom during this time? That'd have been, I don't know
Very
what.
difficult, that's for sure.
Yeah. And I don't think Zoom's going anywhere. I think and I don't mean for our safety meetings. We have our annual managers meeting beginning of May, and I'm sure they'll lay out next year's program and the details. Right. So of course I'll let you know.
I don't think it's going away. I think it'll be there for a little while, at least
really?
Probably the start. But who knows?
Yeah. Who knows? And maybe we'll be rebels without a cause and go in person. We'll see. But next month, let's see, is that March already? That's when Chief Burke from the Middletown Police Department's going to be on here to answer questions, talk about crime and safety in the Middletown area, concerns, some advances they've made, and so forth. So we hope you'll join us then. And Joanne, thank you very much. Everybody have a great day. Spring is coming soon. Yay, hopefully.
Thank you.
All right. Bye everyone.
Bye-bye.